Welcome back, everyone. If you are in the Northern Hemisphere, I hope you are having a nice summer or start to your summer, as we recently celebrated the summer solstice here. And if you're in the Southern Hemisphere, I hope you are ready for a nice winter. As we wait for people to join us, please share in the comments, where are you tuning in from? And I am excited to introduce today Shay Pausa. She is also known as Mrs. Healthy Gut. So for those of you who have been part of our community for a long time, you are very familiar with the Healthy Gut products. Shay is Stephen's wife. And so we are very excited to have the second half of this amazing partner team that we love their products, we love their community, and we love their expertise on all things gut health. And as you know, we are in Hormone Month. So today's show is MCAS, hormones, and gut health, what every woman needs to know. And our lead practitioner, Kimberly, should be joining us. She's having a little bit of technical trouble, so if she's unable to join, we'll still have an amazing conversation today. So before I bring up our special guest, let's go over our quick disclaimers. This presentation is for informational and educational purposes. It's not meant to treat, diagnose, cure, or prevent illness, so please be sure to discuss any health recommendations we make with your healthcare provider. And just a reminder, some of the links shared during this presentation or on our website are affiliate links, which means MassCell 360 may take a very small commission if you purchase through the link. We only recommend products that we love and use personally or use in the MassCell 360 practice. Okay, so today we're going to be talking about how gut health and hormone balance is connected, what women need to know about that midlife shift, what are some gentle first steps you can take towards balance? What are some daily habits to support long-term wellness? And we did some of that last week as well. So you can always check out our archive of videos, specifically over on YouTube. So we are streaming both on Facebook and YouTube. With the new Facebook going on, they're deleting videos after 30 days. So please go find us over on YouTube and make sure you're subscribed to our channel. And if we have time, we will do a live Q&A. So just some quick reminders about that. Please only post your question one time. It helps us stay organized. Please keep your question on the topic of today, so gut health, hormones, and MCAS. And then please understand that we're unable to answer in-depth personal health questions. Okay. So welcome, Shay. For those who don't know, Shay is the co-founder and COO of Healthy Gut, which is a leading gut health brand. She has a career spanning healthcare technology and years of reporting on women's health issues. Shay is a passionate advocate for women's health. And as a cancer survivor and women's health advocate, she promotes the importance of being a smart consumer of healthcare and encourages women to take charge as the CEO of their own health and well-being. I love that. I feel like everyone needs to needs a reminder every once in a while that they're like in the driver's seat of their own health, right? Like we can go to doctors, but the health doesn't start in the doctor's office. It starts way outside. So Shay's mission is to empower women to make informed decisions and lead healthier, more fulfilling lives. So guys, if you are on this call today, please feel free to stay and learn and be advocates for women's health as well. Learn something so that if you have a special someone in your life, you can know a little bit more about what's going on for them. I know my husband was actually the one who pointed out that my migraines were happening at the same time of my cycle every month. We didn't know it was histamine yet, but he was like, I think it's related to your cycle. So having an attentive spouse or partner can be really helpful. All right, Shay, welcome to.
Thank you so much for the lovely introduction. I'm happy to be here. MassCell 360 means a lot to us personally and professionally. So
yeah, I'm gonna bring these slides down and just kind of ask some personal questions so that our audience can get to know a little bit more about you. Can you start by sharing a little bit about your personal story and how you became passionate about women's health and gut health?
Yeah, so my passion really started long before I had a personal health journey, to be quite honest. I grew up professionally in healthcare technology. And so that meant I was calling on doctors' offices and hospitals from a really young age and finding out about the business of healthcare. And that's probably what got my attention really early on. Was I recognized, one, it was a business, and it was a for-profit business. And I could see how the profit drive often left people just kind of going along with whatever the doctor said or whatever the insurance company said. And it just had me realize that there was nothing more important than our health. You know, there's that expression that says a healthy person has 10,000 wishes and a sick person only has one. If we don't have our health, we don't have anything else. And so I saw really early on how the organizations with technology were making all these decisions about what people should or shouldn't do about their healthcare. And my immediate reaction to that was, this should be put back into the hands of the people that are really driving the decisions. And in most families, that means the women, because women don't just decide for themselves. They decide for their children, they decide for their partners, and they decide for their aged parents. That's just what happens. And so I thought, wow, we really need to have a way for women to become more informed. And I think, you know, I grew up in a time where, you know, Google became a thing. And I think that was wonderful to provide us information, but it didn't lead to empowerment. It led to a lot of information overload. So I thought, how do we start to really educate people so that they can make informed decisions outside of what you're told you can or can't do based on an insurance claim? So that's really where it started. And then you mentioned it in my bio, I've been diagnosed with cancer 3 times in my life, and I'm not that old. It's a lot of times to be dealing with cancer. And so I have had the experience of receiving a big diagnosis. And I have to say that with each time that I was diagnosed, there was a shift in me personally about how much I was going to hand over agency to someone else to decide how I was going to care for myself. And so, I just really, I realized how many people struggle with that when you get a diagnosis or you're dealing with perimenopause or whatever it might be, that you have to make a choice about how you're going to manage that. And I believe in an empowered way of managing that.
Yeah. Well, and you're a survivor 3 times. So
far, so good. Yeah.
I'm sure you have lots of wisdom to share with this community. So both of our communities, Mast Cell 360 and Healthy Gut, we hear a lot from people, especially women, that they're dealing with like the overlap of gut symptoms and hormone symptoms. So why do you think that this may be so common now?
Well, there's lots of reasons for that. First of all, I don't know who coined it, but there's something called the 7 dwarfs of perimenopause and menopause. Have you ever heard this?
I haven't heard that. No, I
think it's funny. It's itchy, bitchy, sleepy, sweaty, bloated, forgetful, and all dried up. It's a very fun take at some of the symptoms that women experience. And of that, bloated is one that I think a lot of people, maybe who've never experienced gut health issues, all of a sudden start to experience in midlife. And part of the reason is that people are familiar now with the microbiome, but we also have the estrobiome, and that's important.
It's talked about enough.
Because I think we're just getting to a place where the average person understands that the microbiome is this trillions of microorganisms, bacteria, viruses, fungi that live in and on our bodies that are kind of regulating everything, especially in our gut. So when it's balanced and working properly, we flourish, we feel good, our food digests well, we absorb all our nutrients, we're protected against illness, and we have good moods and hormones. But the estrobiome is the bacteria in the gut that especially regulates and breaks down estrogens. And estrogens, again, I think we're just like at the tip of the iceberg of what we really understand. But what we know is that these, we have receptors, estrogen receptors, not just in our reproductive organs, but in our brain, our heart, like it's everywhere, and in our gut. And when these go a little out of whack, as happens during the fluctuation of perimenopause, we start to experience these digestive system issues. That can be bloating and discomfort, but it also can be weight gain and belly fat. It can be brain fog. It could be the sleep quality goes away. We lose our libido, or we get really high libido. It's like it goes all over the map. And so what happens when our hormones start to fluctuate, which is completely normal in perimenopause and beyond, we start to experience all these things. And things you may have been experiencing before, you may be experiencing more of now. It becomes, I guess, magnified is probably the best way to say it.
Yeah. Was there a particular moment in your own health journey that kind of made that connection click for you, like between gut and hormones? Because was it when you met Steven and you're like, oh, or what,
Yeah. Thanks for asking that. It's kind of an interesting story. So for those of you that don't know, I'm pretty public about it at this point. I wasn't so comfortable in the early days. We've been together 9 years now. And when I met him, I thought he was 7 years older. When he met me, he thought I was 7 years younger, and we were both wrong. So you can do the math. So all of a sudden I was a midlife woman dating a younger man. And I didn't experience any symptoms. So to this day, I've never had a hot flash. So, I could say that and I had a regular period. So I could have said oh, there's nothing happening. But I also knew some things were just changing and were different for me that I couldn't quite put my finger on. So Stephen, who came from a traditional functional medicine health background, immediately went to estrogen dominance. You got to get rid of all your estrogen. He put me on,
rid of all of it.
Right. He was just good, get you on DIM, and we got to do this, that, and the other thing. I did that for about a week, and I was like, I feel worse than ever. I am just disagreeing with you. And he was like, but I know so much. I'm like, I understand that, but yeah, no, not for me.
I'm an individual.
I'm an individual, and I'm going to figure some things out on my own. So I became a fast and hard student of this. And I had a click moment. And I mean, I had every book that you could imagine, from the ones that said, do everything natural, to the ones that were get on BHRT immediately and change your life, and everything in between. And my reaction was to just listen and to learn. And then I heard a podcast that was called How to Have the Hormones of a 20-Year-Old. And it was Dave Asprey's Bulletproof Radio. Okay. And he had on this lady, Susie Wiley, who wrote the book Sex, Lies, and Menopause. Now, again, I was dating a younger man. So I was like, I would like to have the hormones of a 20-year-old. Sign me up. And at that point in my life, I hadn't slept well since my children were small. And I just thought that was normal. But I decided to go on and try this approach of rhythmic dosing. And I did it. And within 3 days, I was sleeping a full 8 or 9 hours a night. All of a sudden, I felt like everything was just sharper and clearer. But most importantly, I felt like the part of me that had just ambition and drive and I could do anything, I hadn't even realized it was gone, but turns out it was. So for me, that was when I was like, wow, these are really powerful tools that I should take a look at. I, at the same time, had been experiencing gas and bloating, which I had never had before. And that also cleared up when I started to introduce a different way. And keep in mind, I was dating a gut health professional. So the way we ate was clean. We were doing all of the right things, fermented foods, you go through the list. And I was still having some struggle. So that was a light bulb moment for me of just the power that our hormones are playing in our system and how it impacts gut health as well.
Yeah, it's really interesting. I mean, gut health and hormones, I feel like in this community, when you've been on it for a while, it's kind of chicken or egg.
Yeah.
And so for you, it kind of sounds like hormones were the chicken, but then,
Yeah. Oh, totally.
But
yeah. And I tell, I come from this, from a girlfriend's approach, what would I tell my girlfriends? And what I do tell my girlfriends, because some of them have said, well, my doctors have said, I have to handle this first before I can handle hormones, or handle my hormones first before I handle this. I personally think that they are so connected and such a circle that you address both simultaneously. And what both means for you is very individualized, but that seems to be an approach that then you take care of your gut and your hormones all at the same time.
Yeah, so that's really a great point, because like we have the MC360 method, and it's kind of like, oh, we like guts and hormones actually come down in stage 3, because for us, our population's so sensitive, we have to work on stabilization. And for us, it looks like nervous system support. And you mentioned earlier, like, how can women make informed, empowered decisions, because they're like the main decision makers for the whole family. I also like to remind women that like nervous system's so important, because you're the central nervous system of your whole family. It's like, when you're not right, your kids are more grumpy, your husband's more grumpy, right? And so, yeah, so just remembering that you kind of are the central nervous system of your family as well. But yeah, gut health, I don't think, like, when people know they have hormonal issues, gut health isn't necessarily the first thing that people may think of. So what would you share with today's audience? Like, why does that matter so much? Why should they be thinking about gut health at the same time as hormones?
Yeah. So I have seen it happen where someone has jumped onto some kind of BHRT or HRT program without addressing what maybe, they might have dysbiosis, they might have a parasite. And if they do,
I just want to pause real quick to let someone who may not know,
Oh.
BHRT is bioidentical hormone replacement therapy, or HRT, hormone replacement therapy. So if you've been at this a while, you probably are familiar, but if you're kind of new to that area, that's what Shay means by this.
Thank you. Thank you. I appreciate that. Yeah. So I think I have seen people dive into that without dealing with some other base things that are going on with their gut, which obviously impacts their immune system. And like you said, nervous system dysregulation is a huge thing, because if you have that as an underlying factor, you can put all the other protocols on top of it. Probably isn't going to work as well as you'd like. That's just the truth of it. But if you put HRT on top of a already unstable gut, you're not going to get the full benefits of it, because they work together, because they have those estrogen receptors in the gut as well. So it is important in my mind to address both simultaneously at the very least.
That's a great point. Okay, so you're a strong advocate for women's health and empowerment. What are some things that you think women in particular need to know when it comes to hormone balance and gut health?
Yeah. So we were talking about this a little bit before we started the show, of like, when is this actually starting for people? And I think this is really foundational. So first of all, perimenopause, which is the period of time prior to the 12 months without a period, which is officially menopause. That period of time is what I refer to as a reverse adolescence. And I want you to think about adolescence as to how long you were an adolescent, because we know that for some kids that can start as early as 10 to 12 years old, but our brains are not fully out of the adolescent stage until we're about 22, 23 years old, because our brains are still developing. Reverse adolescence is kind of the same thing. It can be 6 years, but it can be up to 12 years long. So if you think of the average in America right now, it's 51 years old that women reach menopause. You can do the math. 6 to 12 years prior to that is when someone could enter perimenopause.
Yeah.
Now, why is that important? Well, it's important because if you don't know what's happening, you might start addressing a lot of the symptoms as a different problem than you actually have. If you know that, oh, this could be perimenopause, there are ways to address hormone dysregulation that you might not address if you were thinking, oh, something's happening to me and something's really wrong. This is just a stage of life, and there are ways to approach this stage of life. But I often hear women say, oh, that I'm too young for that. I have a regular period. I always chuckle a little bit and I'm like, well, you're 43 and you have a regular period. But again, if we do the math, you might be experiencing some perimenopause. It's just possible.
Yeah.
So if we get out of that like denial of it and saying I'm too young, it gives us more, I guess, empowerment of what the options are and what you can do about it. And there are lots of stages of that. So the first thing is to have the recognition of it's possible. Yeah. The other piece that I really encourage people is to track what's happening for you really on a day-to-day basis. Because as you mentioned about headaches and realizing there was a histamine relation to your cycle, if you don't know that, like, hey, I keep having a headache on day 21, I wonder what might be going on there. You wouldn't be able to say like, oh, this could be the reason. So I tell women, keep a diary. It can be on your phone. It could be a period app, like pick whatever you'd like.
I was going to say, there's so many apps.
There's so many. Yeah. Pick a way to track it so that you can start to see if there's some real patterns, and those patterns will help you decide what to do next and how to approach it.
Yeah. And that's my biggest thing. So I don't know if this community knows this about me, and I shared this with you earlier, but prior to getting into the mast cell activation syndrome and mold toxicity world, I was doing preconception and pregnancy coaching because there were so many things that we can do preemptively, like before we have a problem getting pregnant. Like, let's just clean up the body. Let's remove those endocrine disrupting chemicals. And those are some of the things that I had talked about on the live last week. But I like to empower women and basically be like, look, your monthly cycle is like your monthly report card. Your bowel movements are your daily report card. Your cycle is your monthly report card. And I love the book. I don't know if you'd have read it. You probably have, but The Fifth Vital Sign, and just reminding women that like your cycle really, really can tell you a lot about your health. And I just feel like there's been a disservice to educating women on really what's going on in their bodies. Like high school sex ed did not cover this in a way that really empowered women. And I had cystic acne when I went into college, and finally, like being in a new environment, I was just like, I want something to fix this. Like I wanted the magic pill, I wanted the quick fix, and I went on hormonal birth control, and everything got worse. I went on hormonal birth control and moved into a college dorm at the same time. So was it hormone disruption? Was it mold? Was it both? It totally could be, but I couldn't eat without being nauseous for a whole month, like acid reflux, brain fog. So like there was a lot going on, plus the stress of making new friends, introducing alcohol, like talk about like the perfect storm, which, to your point, like I'm 18 years old. So there are people who may have only been in that adolescent phase. I didn't get my cycle till I was 14. I was a late bloomer, right? I'm only 4 years into this. And like talk about the environmental aspects of what your environment can do to those hormones and gut health. So I think it's really important that like women get that message of like, let's track, let's actually understand our bodies and what's going on that deeper level.
Well, I think it's interesting that you said like we don't get enough in high school sex ed at all. I had never seen, until I was studying perimenopause, again, for very personal reasons. I wanted to stay young and vibrant as long as I could for this younger man I was with. And I really had never seen like, oh, here's how estrogen is a curve in my body. And here's how progesterone works in that curve. Oh, and testosterone. And by the way, when those hormones are fluctuating, so is everything else. Your thyroid fluctuates during that time. It's this cascade. And if you don't recognize what is supposed to be, like this is what a 28-day cycle should look like, it's really hard then if you have perimenopause and it starts fluctuating even a little bit, you're like, that's weird.
You don't even have like a baseline understanding.
You don't have a baseline. So I really encourage women, start young in understanding your body and getting to that as close to perfect cycle as you can.
Yeah.
And I love that you use that as a report card, because I think it is so much valuable information that we don't have going into perimenopause.
Yeah. No, I think that's like, if I could, I don't have a daughter, I have a son, but I want him to understand that women's hormones shift monthly, like, so that when he becomes somebody's partner, that he understands. Yeah. So, the biggest thing, and majority of the people in this audience are dealing with that midlife big shift in like both areas, gut health and hormones. So can you share how perimenopause and menopause can impact gut health, hormone balance, and just how we feel overall?
Yeah. So as those hormones start to fluctuate, and again, fluctuation is totally normal for many years prior to perimenopause, you can start to see these symptoms show up. And it can be such a wide range. So it's very hard for me to say like, this will happen to you. Right. There are, I think, I just did a thing once where I was like, I wonder how many symptoms. It was over 100 symptoms that I was able to come across
related to that shit.
Yes, yes. And so many of them were related to your gut. Like some women have diarrhea, some women have constipation. Like what? But how is that possible? Well, again, because of what's happening, our gut bacteria is changing all the time. And we know that those things are going to have an impact on your bowel movements. They're going to have an impact on your digestion, how you feel. And then add on top of it that we also have social media telling us, eat more protein, do this, do that, which not bad advice, but if you do it without
fast, right? Everything under the sun.
Yes. So those, so when I mentioned just like the gut health symptoms that can show up, anything that shifts, I'm just going to say something very general. If you're over 40, just consider that it could be hormone related and not just what you're eating. Not just what you're taking. It has some other things that are happening. We know that just with age, as an example, our stomach acid decreases. And what does that look like in a perimenopausal woman? Well, some people joke around about it almost feels like a shrinking ponytail. You're like, I used to not be able to wrap it 3 times. What's going on there? Our hair starts to thin. And why is that? Because we're not breaking down the protein and absorbing it. That we need those protein in order to have thick, healthy hair, skin, and nails. So kind of a little small thing. I paid attention to it because I was a little bit vain, to be quite honest. But I had no idea until I, got involved with a gut health expert that my stomach acid was decreasing.
And because you are part of Healthy Gut, I just want to share the Healthy Gut product because people are like, oh, I wouldn't have connected thinning hair. Like that one is very thyroid and hormone symptom-like, but then to think about the need for stomach acid to break those proteins down so that you can have that continuous lovely hair growth. So the Healthy Gut HCl for stomach acid and helping break down that protein is HCl Guard. Now, again, this is a product that we use well in our clinic with a sensitive population, but there are some things like ginger in there, which not everyone may need. But so stomach acid in general can be helpful. So the link at the bottom of this, mastcell360.com/store-healthy gut is to our store. But I also want to throw this banner up because if you're brand new to Healthy Gut products, you can get 15% off your first order at mastcell360.com/healthy gut. That takes you that's our affiliate link. In full transparency, takes you to their store. If you use that code mastcell360, you get that 15% off. So that's great if you're a first-time buyer. They have a 60-day money-back guarantee. So if it doesn't work for you, and if you have health-related questions on their products specifically, they have a great team of health coaches that can support you. I also just want to let you guys know, I'm going to switch back here real quick. Bear with me, but we have a special code on our website, on our store, that's good until the end of this month. So if you're a repeat buyer and you want 10% off, you can use code HEALTHY10. So that's just, we try to give gifts to you guys as much as possible. So yeah, thank you for sharing that little piece because I didn't even think about that connection of hair thinning and stomach acid.
I wouldn't have known it at 30, that's for sure. And another one that is related to low stomach acid, which I didn't know until I was with a gut health expert. I had experienced for many years silent reflux. I didn't know, like, if anyone said, do you have heartburn? I said no, because I never experienced any burning after I ate. Turns out that you can have silent reflux, which can go without symptoms for years. And what that can cause is issues in your esophagus. So if you're a midlife woman who's suffering with a dry cough, and I was one of these women who went to, upper respiratory folks. I went to all the doctors. Everyone said, we don't see anything.
Interesting.
And my husband who said, I've often suspected, I love it when he suspects things about my health and then he springs it on me, that
I've been watching you.
Constantly. Yes.
It's like you can sense the eyes on you at all times.
Totally. He said, I think you have silent reflux. And I was like, I mean, I don't feel anything. He goes, that's why it's silent. And I go, that doesn't make sense. It should mean that you have no feelings.
We come up with a new name for that?
Yeah, we come up with a new name. But sure enough, low stomach acid again. Silent reflux can't be like foam, phlegm in the back of the throat. I possibly, yeah. I mean, I think anytime for me, it was a dry cough, which was just because the esophagus was basically not, was getting irritated. But yeah, I think it can show up in a lot of different ways and it's worth checking. And there is an HCL challenge you can do. And I think that is important to try because it'll tell you quickly if you need a little stomach support.
Yeah. And with like that phlegm, that postnasal drip kind of, we see that a lot in our community with overproduction of histamine and usually in connection with like a mold toxicity, irritating the sinuses constantly. So you get that drip. Again, this is generalization. It's not saying this is what's causing your phlegm in the back of your throat, but we really want to advocate and empower you to kind of dig into some of those root causes.
Absolutely. Absolutely.
Okay. All right. We took a little side.
note. Sorry. It just popped up and I saw it and I was like, oh, that's interesting.
Are there other, let's see, what were we talking about? Were there other symptoms of like perimenopause and menopause that kind of impact those gut hormones? I know we talked about, so the stomach acid in relation to the hair.
We talked about bloating. I think bloating is the most common one that we hear, or changes in bowel movements. And again, the changes can go in either direction, more motility or less. Again, I think we have to look at gut health as a constant in our lives. We're always should be looking from the time we were a baby, like just always be thinking about the gut and how we can support it because it's our immune system. It affects so much other things. But if you are in the stages that could be perimenopause, also look at, has this increase? And again, looking around the cycle, because that will give you so much information. And if you're postmenopausal, still track the symptoms. Because I've known women that have had what you would consider perimenopause symptoms well into their 70s and been miserable, by the way. It's just not necessary. So I think knowing that what stage you're in and then tracking your symptoms is going to be the greatest way to figure out, how do I solve for this?
Yeah. So for women who may be considering that bioidentical hormone replacement therapy or other, midlife hormone supports, what are some of the key things that you think that they should keep in mind?
So first of all, there are so many ways that this is administered. Up from the most natural, so let's say like seed cycling or possibly some type of herb support, that is one level. And then when you go into BHRT or HRT, the options are, it seems endless because dosing is so important at that point. So that could be, for some women, that might be just having a little bit of oral progesterone on board during the early stages when their progesterone is going down. That might be enough to help you with your sleep, handle moods, any of those things. But you also have the ability to take on other types of dosing. So you can do creams, you can do a combination of creams, there's oils, there's injections, like the ways that these things are administered are far and wide. I would not take any marketing information about any of them as like this silver bullet. And they all do talk like that, by the way. And I found, which I have I guess from my own health experiences, I don't like dogma. So I never like hearing this is the only way, because we're individuals and I don't believe that there is only one way to manage something. because of what stage, what's going on in your life. Like you have to add so many factors to like what's individual. So for me, I want to tell women, shop around, get information about what's happening in your body. So that's symptom tracking, but it also could be doing some hormonal testing. So I'm a big believer in don't just take one test, because if you're looking at what the Dutch test says, they're going to tell you that that's the be all end all. I think the Dutch test from Precision Analytic is wonderful, but it's wonderful for certain pieces of information, how your pathways are working. I think if you want to get a different flair of that, you can do a 30-day urine test from another company that will actually give you a bigger picture, because again, we're fluctuating during that stage of life. So you're just taking a picture in time. And then if you still do have a period, I recommend getting a blood serum test for estradiol and estrogens on day 12. And the reason I say day 12 is ideally that should be your peak. That should be the highest day. I don't know if it will be, but it should be. And then do progesterone, which is harder to test in serum, but is the best we can get on day 21. So I think it's really, really important to have data and then shop around. I interview doctors like they are an employee. So when I say you are the CEO of your body, your health, and your life, I mean, treat everyone as these doctors as people you are hiring for service.
I tell people that all the time.
Yeah, I think that's so, so, so important, because if you don't, you'll get told what to do. Mm-hmm. And it may not be right for you. Mm-hmm. So, and then I think another important piece of it is you have to use your intuition as well, because it is tied, I believe, to your nervous system and spirit. And it is the place where you'll be like, maybe this isn't for me now. And that question alone leaves you into a different place of empowerment.
Yeah. And yeah, going back to that nervous system piece and like what you just said, I feel like if we're so disconnected, we're not taking care of that. Like we're not doing self-care. We're not going outside. We're not focused, like doing any sort of conscious breathing ever. We're just surviving. We lose that intuition. And so in order to get it back, we have to do the nervous system work so that we can say, oh, that feels like the right. So if you're sitting there and don't have the ability to use your discretion, that points to nervous system. So maybe you need to do nervous system work because there's fear around the hormonal replacement therapy. And if there's fear around it, it may be the right tool for you, but you're not ready for it, right? So we have to be able to kind of bring the body back into balance so we can get in touch with our intuition so that we can use that as that internal compass to know which tools might be right for you.
Absolutely. Absolutely.
All right. Yeah, we have some good questions coming in.
Yeah, I was seeing some really interesting questions, which I'm happy to address any of them.
Do you want to do some questions now and then we can wrap this up?
Sure.
With some daily habits, I was going to say, ask a few less questions at the end so we can leave everyone with like some things that they can do. Okay, is there one that you saw that you really wanted to?
Well, I'm seeing some questions come up around the testing as well as progesterone and hormone positive breast cancer, which I can speak to. Yeah.
I was going to say, speak to that from your personal experience. And just, again, remember, this is not medical advice. It's not meant to treat or prevent illness.
Absolutely. So I think, first of all, I just want to say something about what a hormone positive breast cancer is. And again, my mom had breast cancer. I've had it twice. Like I feel like I've taken a lot of deep dives. And if you know my husband, you know he's taken some deep dives as well. Hormone positive breast cancer means that the tissue on there had hormone receptors, and they test for progesterone and estrogen. They also test for HER2. All of those receptors are normal. So on a healthy breast, if you took breast tissue without any cancer in it at all, it would be hormone receptor positive. And that's a good thing. That's why when you hear people say that it was a triple negative, it's considered a more aggressive cancer is because there's no way to talk to it in the same way that we know how to talk to cancer cells. So anyway, I think that's an important thing to understand. So that means, and this is another important one, when people say that estrogen causes breast cancer, it does not. we know that it's been debunked. That came about from the Women's Health Initiative study that has now, I won't say debunked, but they've looked at the data now and said, oh, we kind of took this salacious approach to it, and that wasn't actually good information. We hurt women in the process. So is it safe to supplement natural progesterone? There's a lot of things to be said about progesterone versus estradiol, but let's just use some really simple things. Estradiol is considered a growth. Progesterone is considered the brakes. And so for me personally, I chose to not only naturally supplement with progesterone, I went on kind of a higher level of progesterone than what would even be considered normal during my cancer treatment. So, because I was looking at creating that brakes on growth. I wish that breast cancer was so simple that it was just we could just turn off estrogen, progesterone, and you wouldn't have it anymore. It is a perfect storm of things that happens for women. So to say that estrogen or progesterone is a cause or is even leading to additional growth, I think is a bit of a misnomer. But as you said, talk with your doctor and look for doctors who understand and have actually treated people who have had breast cancer or are at risk of breast cancer, so that make sure that they have an understanding of that, because it is important.
Yeah. All right. Let's see. So Olga's asking, if your cycle fluctuates, do you have to rely on day 12 and day 21 for the hormone blood work? This could be where tracking your cycle comes in really handy, so that, like, for example, I ovulate on day 12. So my peak would probably be day 10. This is where, like, most people say, oh, you have a 28-day cycle, you're going to ovulate on day 14. If you track, like for me, I have a 26-day cycle. And so it makes sense that everything's like bumped 2 days in advance. So this is where it comes down to understanding if you can track for like 3 months to kind of get an average at the minimum. And then that would help you have a discussion with your provider to understand which days you should go do that blood work. Shay, do you have anything to add to that?
No, that's a perfect answer. Perfect.
Yeah, and Olga also asked earlier, what apps are your favorites for keeping that diary of symptoms? I have used a whole bunch of them. The one that's coming to mind, I really like the Kindera app specifically, but there's Flow, there's a lot out there. So maybe ask your friends, if anyone else, like, use it as a good discussion starter with your friends. Like, hey, are you doing this? Like, why aren't you doing this? Do you have an app that you like? But yeah, I like the Kindera when I was actively tracking. Now I know my cycle really well. So I just use what's built into the Aura app as my like basic. I'm not actively trying to conceive. And so I'm not really worried about like the nitty gritty. It's more just like, hey, I can confirm that I ovulated. And I don't need to, be as careful a certain time of month. But yeah, it's good for tracking symptoms too. So not just symptoms of hormonal thing, but like symptoms of, bloating. Yeah, if there's like, find one that you can take notes in so that you have that data, or feel free to go old school pen and paper. And then that way you have like that, all the information in one place. Do you have an app that you have used?
I've used Flow. So I've gone through a lot of apps. What I'm using right now is something called Artemis that is actually designed for women who are using some sort of BHRT or HRT, so that you can track with your dosing what's happening. So,
all right. Let's see, all right, a lot about hormone replacement. Let's see. I want to go up a little bit just so I don't miss some of the questions that were asked earlier. Can you recommend anything natural for migraine relief until we can get to the root cause? Yeah, so if you know when those migraines are happening, again, going back to the tracking, for me, I was having a migraine every time right before I ovulated. So again, that really high estrogen spike seemed to be my personal trigger. So like do your tracking to find out where maybe in your cycle that migraine's happening. Is it happening frequently? Maybe you're in the perimenopause stage, and so they're happening at different times. So for us at Mast Cell 360, we see a huge reduction in migraine or getting migraine relief from reducing histamine. So a starting point could be the low histamine diet. Some people need more than that. So for me, just doing low histamine strict, like a strict diet, no leftovers, freezing leftovers, no ground meat, all sticking to the foods, like no processed meat, no avocados, things like that. I had not daily migraines, I had daily headaches that I didn't realize I was having till I went low histamine. So that in and of itself, just the diet alone made a difference in my daily life. And then something like DAO. So I'll let Shay speak to his HistaHarmony real quick, and any other additional tidbits she has.
Well, I just want to say HistaHarmony would not be a product at Healthy Gut if it was not for Mast Cell 360. So we were very close to Beth, and she wanted this. She talked about it with us a lot. So I credit Mast Cell 360. And what has been so interesting to see is, DAO happens naturally in our body, but again, not enough. It can be taken with meals. I like to see people be able to enjoy their lives and eat food that they want. And sometimes that includes wine as well. And a lot of perimenopause women were telling me that they were struggling with having a glass of wine. And I was like, oh, I believe that's a histamine reaction. Also, we know that histamine fluctuates tremendously during our period. So like you, I was experiencing headaches literally on a certain day of my cycle. And now I just take HistaHarmony. I just take a couple of extra that day and no headaches whatsoever. Yeah. So I think it's a truly, like, it's something you can keep in your purse. It's, a little blister pad. Yeah, I mean, it's just so helpful. So if you have any FODMAP issues, just always have this on hand with the food. My goal for everybody is to help you eat and enjoy life and, and really just feel like you can do so without any pain, not digestive pain, not headache pain.
Yeah, and for those who don't know, DAO is the enzyme in your body that breaks histamine down. And so if we have some gut disruption, like I have celiac disease, but I didn't get diagnosed till I was 21. So that's like years and years of gut damage. And so I probably don't produce enough DAO on my own anymore at this point in my life. And so having this on hand allows me to kind of, like you just said, enjoy those foods. If I'm eating out, I always have it on me for spur of the moment, just because I have a more sensitive gut. And so it's been very helpful for bringing that histamine load down in the body. And yeah, typically if you're going to do it with meals, because you're going to eat a higher histamine meal, that 10 to 20 minutes prior to eating can help. It does have a little bit of MCT oil in it. So for those with salicylate issues, it may not be the best, but that really depends on your individual sensitivity levels. We have seen people able to do it. Our population's pretty sensitive. So like crushing the tablet, we know we've fully alerted Stephen that we do this. It does reduce the effectiveness of it, but to allow people who may be more sensitive to titrate up, it is pretty well tolerated. And again, on our store, we have a low salicylate option as well, because we're always trying to have options for you guys. But yes, we've kind of migrated over to HistaHarmony being our first recommendation. Okay. Let's see. Next question. Move that. Can all this start in a young woman who's in their 20s? What is the best way to deal with hormonal acne and migraines without hormone therapy? So Shay, I'm going to let you speak on this one, and I'll add anything that I can think of.
It would be very rare for a woman in their 20s to be in perimenopause. That's going to be way, way, way on the outside. So
it may not even be in her adolescence.
Yeah. I don't think that's going to actually be an endocrinology issue that's happening if that's occurring. So I would say that is hormonal therapy is probably not the right place. And traditional medicine is going to try to just say birth control pill will take care of all and neither of those are a good way to handle things. So I think hormonal acne and migraines, there's probably gut health issues that need to be addressed first and foremost.
Absolutely.
You need to make sure that the system is working well. Right now, where we're seeing young women have these issues are really with the endocrine disruptors that are in everything that are happening around us. The stress that I think young people are faced with now that we never experienced 20 or 30 years ago because they grow up now on social media and things that weren't there. And we have EMS around us constantly. There's probably also toxins in our water. And even if you're eating organic, it still gets rained on by everything else. So with all that said, I would say you have to start with the basics. So I think nervous system. So we need to take a look at that. We need to go ahead and address the gut, starting with what are you eating? And then we need to look at the toxins and what is in what you're putting on your body. I personally did not recognize just how every product had things that I did not realize were endocrine disruptors growing up. I just didn't know in my 20s and 30s that there was putting things on my skin, on my face, like on a daily basis that were endocrine disruptors. So I think you have to get really clear about those things and change. And then again, note what's happening, what changes when I do a shift.
Yeah.
And that's going to help you really to be empowered in guiding yourself in that process.
Yeah. I mean, I was this person. I had the hormonal acne. I had the migraines, I had the brain fog, like right in that, early 18 to 22 timeframe. And I like the advice I wish someone had given me was like, remove all the like toxic products, change your diet. And I mean, I was eating organic as much as possible growing up, and I was still having horrible, horrible symptoms like the acne, the cramping. So there were signs like, I don't remember my bowel movements back then, but I tell people, I'm like, you should be pooping every day now. If you're not, like, you should be. So like, we need to open up those detox pathways. So like, yeah, the hormones and the gut stuff come at a basic level in our stabilization to get you to open up those detox pathways. Let's clean up the environmental triggers. And then if there's mold involved, if there's not mold involved, then we kind of jump down and like go deeper into those hormones and gut stuff. But yeah, I actually spoke with a woman in her 20s this morning, and she was complaining about the acne. And I was like, honestly, I would do 2 weeks gluten and dairy free, just 2 weeks, just to calm the inflammation in your body. And then my next advice to her was, and remove everything with synthetic fragrance. Like if it says fragrance on the ingredient list, like let's find a swap.
Yeah.
And then I was like, oh, and your liver probably needs help.
Yeah.
We need to support your liver and open up those detox pathways. Because once it gets to the skin, it's kind of like that last ditch effort. Like when I was diagnosed with celiac disease, the functional doctor I was working with at the time was like, what's going on the skin isn't a reflection of what's going on inside. And so you kind of have to go back. So I'm sorry this is happening to you, but yes, go back and watch last week's Facebook Live. We have a lot of ideas on some things you can do to balance those hormones day to day. All right. Someone is asking, so Amber's asking, is hormone replacement therapy worsening my mast cell activation? So that's hard to say because we don't know enough about your individual case. If it's not being really well tracked and guided by a health professional, it could be. Are you tracking to make sure, like Shay mentioned, that she's using a tracker in relation to the dosing of her hormone replacement therapy? So is the dosing wrong? Maybe are those levels right or wrong? That would be tracking the symptoms, your dosing, and your MCAS to see if there's any correlation. So that would be our suggestion there. Do you have anything to add, Shay?
No, I think that's absolutely true. I mean, the answer is it could be, maybe, and it depends, like, which are not yes or no's. But yeah, I think you have to have some more information. And the other thing too, and this goes back to just being an empowered consumer of healthcare, and I use that term, a consumer buys and shops, right? Like we look around. If you're getting information from a doctor and it doesn't, like, they're like, no, just work through it, or no, one has nothing to do with the other. And again, intuitively, you're like, but something's still not right. Go to a different practitioner who has a different way of doing things and gather more information. It's worth it to do it.
Yeah, so that's kind of what Diane is asking. Is it safe to start hormone replacement therapy during menopause? So she's hearing one thing from one doctor and one thing from another. So Shay, I'll let you speak to this one. But again, just going back to that intuition, like, where do you feel like what you need?
Yeah. So again, for 20 years, there were doctors who were saying that estrogen caused cancer. Like, that's how it was presented. And the headlines were very salacious. If you want to know more about the story, the book Estrogen Matters is one of the best out there. And it was co-written by an oncologist whose wife and daughter had breast cancer as well, and chose to use HRT. So that thinking of all doctors saying no to it, I mean, literally thousands of women in one day just went off what they were already prescribed, and probably suffered other things because of it. So I think depending on where that doctor was in their practice, in their teaching and learning, is going to really dictate how they have an opinion on this. There are other doctors who will go so far as say you can treat breast cancer with HRT. Another school of thought, again, extremes on both sides. Gather more information, and then and this part's hard, you really have to do your own research. And research has even gotten hard because you Google something and who knows what information you're going to have. Even ChatGPT will lie to you sometimes. Like, it's hard right now to get to the truth. So I like to look at actual studies whenever possible. And I think that is important. And ask the doctors who are telling you this stuff, show me the data that supports this position. And then again, just talk to other practitioners. And I think girlfriends are a great source of it. I don't think I'm a Gen Xer. We didn't talk about this enough. I think we are the generation, though, it's going like, we're going to come out of the shadows here and say, hey, what's going on? And demand answers. So talk to your girlfriends, get more information, and definitely read as much as you can of actual studies.
Yeah. Diane had asked also earlier, can a white tongue coating be a sign of silent reflux? So we typically see that with candida, which is candida overgrowth, I should say, because we all have some candida in that microbiome that Shay was talking about in the beginning, which includes not just bacteria, but viruses and fungus. And so having one thing out of balance can create symptoms. And so just wanted to mark on that one. We do have a great blog on Candida and MCAS connection. So, okay. Lauren is asking, can you be in perimenopause and still have regular cycles? So you alluded to this earlier. So she had done a Dutch, her levels are super low, and have all the estrogen rate. Yeah, so you're having a lot of symptoms.
Absolutely. I would say, based on just symptoms, it's probably perimenopause. And you can have a regular cycle. My mother is an example. She had a regular cycle until her last period. Like, she never missed a month of her cycle.
And then it just ended?
And it just ended. Now, She was a woman who would have said, I really didn't have symptoms. Of course, she was having a deterioration of things that were going on that she just wasn't really, because she didn't have, in her mind, hot flashes meant symptoms. That's because in her generation, that's what they grew up with. So you can absolutely be in perimenopause and still have regular cycles. Just like an adolescent at 12 might have her period, she's still an adolescent. She's still going through the fluctuation. And I can prove that because I had a daughter. I remember all those. So I would say if your Dutch levels are showing that you're super low, you probably are. And if you can find practitioners who can help support you through that. Again, it could be as simple as seed cycling, very effective at helping you with those low symptoms or those low levels while you are having some of those symptoms, but still having a cycle.
Yeah. I think that's a great place to end on. I had a few more questions for you. Like, what can we leave people with? So like, what are a few daily habits or supports that you've seen make a real difference in helping women or anyone rebalancing the gut and hormone health?
Well, I think what you said for the 20-year-old is the same for a 50 or 60-year-old.
Remove those disrupting chemicals.
Got to do it. And I know it can be hard. I I mean, I remember the first year that I went without using any sort of deodorant. I was like, this is hard. My husband still tries to get me to not. I don't know if you know this. He doesn't wash his hair. He hasn't washed his hair in years.
My husband doesn't really wash his hair either.
No, this is it a little bit. I think that that's just a hugely important thing. Addressing your gut health like every day. And that's not to say like, it's great to have a piece of cake at a birthday party. We choose ours to be gluten-free and we try to go with natural sugars, but like, we don't want to not celebrate, but clean up your day-to-day life, whether it's the food that you're putting in your body, the products that are on your body, and then what's in your brain and what you're feeding your brain, I think is equally as important. And then don't underestimate for a second the importance of just taking a few minutes each day to breathe and to move. Mm-hmm. And that's the basis of everything.
Yeah. I just want to throw up here because you had mentioned some other products, really just kind of like a quick overview why these might be good tools in the gut health hormone toolkit. And you had mentioned earlier, I think you had called it your perimenopause survival kit. So maybe highlight those. And again, these are just recommendations, things that we use in the clinic. Always use your discretion and discuss with your healthcare provider.
Absolutely. So enzyme support, I think if you're dealing with that one dwarf of menopause of bloated, that it can be a huge help. Anything that we do to break down what we're eating in a better way so we can absorb it better. So Holozyme is wonderful if you're experiencing bloating. Tributyrin X, which is a butyrate product, I have a really difficult time explaining this scientifically. But butyrate is naturally producing from our gut right now. And as you age, it also decreases. But butyrate has been shown to be a natural GLP-1. That's kind of cool. So it can help regulate what our hunger is like. It can regulate how we're absorbing things. It also is wonderful for healing leaky gut, which is another thing that can happen during this stage. So those are from the gut perspective. The DAO, we already talked about HistaHarmony. If you're experiencing perimenopausal or just in normal cycles, headaches, try it because there could very well be a histamine issue related to it. You want to have a glass of wine, have it in your purse. Those are just really wonderful tools. But my favorite product, the thing that Shay Pausa can't live without, is our Holoimmune product. And this, I'll just share a quick story with you. Stephen created Holoimmune right at the onset of COVID. And he was really focused on how do I prevent Shay and my parents from getting this. So we didn't really understand what COVID was early on in the process. So he looked for these paraprobiotics, which are basically heat-killed strains at a certain point of efficacy that actually had information to say this addresses upper respiratory. So that was his goal. He was just trying to prevent me from getting COVID. He also wanted to get me off of seasonal allergy medicine. So those were his two primary goals. That is not why I love it. I don't take seasonal allergy medicine anymore. We all caught COVID, so it didn't prevent that, but we're all alive and well. But as far as what it did for me that was so shocking, and I consider it like our Post-it note moment because it was the side effect that we didn't expect was going to be the real effect, is my mom had just passed away. And my coping mechanism was to play these word games on my phone. And so I started taking the product in February, which was right before allergy season in Arizona at the time. And my scores started going up after taking Holoimmune. And I was like, what's happening? So I brought it up with Steven just one day and said, hey, I've been taking, the only thing I know that's different is I've been taking Holoimmune, but my brain feels, I don't know, it's like I got my 20-year-old brain back. And he said, I've always suspected you had neuroinflammation. I was like, again, why are we suspecting things about me like this? So we ended up doing some tests where I went off the product, tested for neuroinflammation, went back on the product. And sure enough, I showed signs of neuroinflammation. As you learn about perimenopause, we find out that yes, because of the hormone receptors in our brain, it's part of the reason we get brain fog and other things like that is there is neuroinflammation that occurs. So Holoimmune gives me my 20-year-old brain back. It also keeps me off seasonal allergy medicine, and it's great immune support. But the 20-year-old brain part is enough for me to say yes to. So I consider if you have that in perimenopause, give it a try. You'll know within 3 days if that is something happening for you.
Yeah, I'm not in perimenopause yet, but I'm like, I want a 20-year-old brain.
It really was. Life-changing for me. And then we tested it with we asked perimenopausal women to try it, and it reported back that they had improved cognitive function. Some mentioned speed. And then we also had somebody on the team that had a traumatic brain injury that we knew was neuroinflammation. And so we updosed her with 2 with each meal, and her dizziness ceased within 3 days.
Wow.
Yeah. So that's...
Yeah, I feel like we learn something new about your products every time we have like Steven on, and this is your first time on with us, maybe not your last time, because we love Healthy Gut. Well, Shay, thank you so much for being here with us today. I'm so sad that we were unable to have Kimberly with us due to technical issues, but it was so lovely to have you. Are there any parting words that you would like to share with our audience? Any words of hope?
I love words of hope. I want people to know that whatever you're experiencing and whatever diagnosis you may have received, that you have the ability to change how you feel day to day. And that is with a different mindset of being empowered and being willing to take ownership of what your experience is like. So there is always hope. If you're still breathing, there's hope.
There's always hope. Yeah. And if you're kind of not sure where to start, I just want to remind you that Healthy Gut, if you have questions specifically about their products, so like I see questions like, is it okay to use DAO without a gallbladder, things like that, be sure to discuss that with your healthcare provider, but also with the team that is the experts on their products. And then if you're kind of like new to all of this and aren't sure if the symptoms you're having are even related to hormones, or maybe they're high histamine, we can do a strategy session and figure out, are those symptoms connected to certain parts of your cycle? And so that would be a foundational tier for a strategy session. Or if you know that you've done some testing, you've done the Dutch test, and you know that there's a link between those hormones and your mast cell symptoms, I encourage you, if you aren't working with somebody knowledgeable in this area and are looking for that level of support, you're welcome to apply to our remote health consulting clinic. You can find options both foundational for the strategy session and the advanced track at mastcell360.com/application. So thank you again, Shay. It was so nice to have everyone here. And I believe we're going to have Dr. Neil Nathan on next week, everyone. So be sure to mark your calendars for June 30th at 1 p.m. Thank you so much for being with us today. Have a great one.